it affects more than 1 million people. It generally takes about 10 years to diagnose.
It's bipolar disorder, a mental illness. But Leah is here to tell us there is hope, Leah. There is hope, Suzanne. Bipolar disorder used to be called manic depression. It's characterized by both severe depression and intense mania, or states of extreme energy. And as one woman tells us, it can take over your life until you get a diagnosis and the right treatment.
No, I'm sorry. Captain Zoloft and his Commander-in-Chief, Colonel Maxwell, aren't available for interviews. They're involved in negotiations with the Prozac Nation and the Lithium Liberation Army.
The names for drugs used in the treatment of mental illness sound like they're from a Star Trek sequel. That's the joke from Victoria Maxwell's play, Crazy for Life, about her struggle with bipolar disorder.
In my manic states, I would have tons of energy. I'd be spending too much money, really promiscuous, things that I was really ashamed about. And then the depressive side was when I was suicidal.
It took Victoria's doctors almost 10 years to come up with this diagnosis.
Rapid cycling, mixed state, bipolar disorder with mild temporal epilepsy, generalized anxiety disorder with psychotic elements.
She laughs now, but at the time it was scary, and it meant she had an illness that would last a lifetime.
If I had diabetes and I needed to monitor it and deal with the insulin aspect of it, it's the same thing. And mainly it's because it's chronic and it's severe.
Bipolar disorder is a chronic illness, and psychiatrist Dr. Chris Gorman says the cause is unclear, but there are many theories.
It's an extension of normal behavior. We all have mood swings, but that these people have a greater degree of mood and energy swings.
Which to a certain extent can be a good thing. Bipolar patients tend to be more creative and have more energy, which is one reason why Dr. Gorman thinks the incidence of bipolar disorder is increasing.
When you have a condition that provides benefits from an evolutionary perspective, you're going to see more of it over time.
But the disorder needs to be controlled.
We should be treating the patients earlier in life, and we should be using combinations of medication and psychotherapy, which is an important part of the patient's recovery.
That combination works for Victoria. She's a successful entrepreneur and a sought-after keynote speaker across North America.
It takes a lot of courage to ask for help, but when you do, there is help available. It takes time, but recovery is possible.
Now, if you'd like to hear more from Victoria and Dr. Gorman, they're both speaking tomorrow night at the Metropolitan Conference Center downtown. For more information, call 263-7408.